ankle injuries can really set you back. You don't realize how important your foot is until it hurts or you can't bear weight. Trust me, I know from experience. And with snow and ice in the winter making things slick, injuries like this become more common. Dr. Uma Arard is an orthopedic foot and ankle surgeon at Corewell Health talking about prevention and treatment. And she joins us via Zoom this morning. Doctor, thanks for being with us.
Thanks for having me.
So talk about some of the most common foot and ankle injuries that you see.
So some of the most common things that I see are ankle sprains. That's very common. Once we get kind of a lot of ice out there, people will just step out of their car and they'll turn their ankle. They'll sustain a fracture of the ankle or a really bad sprain. That's probably one of the most common things. I also see a lot of foot injuries, foot fractures, a lot of toe fractures, people dropping stuff on their toes and breaking their bones. And so I see quite a bit of that as well.
Okay. So I know sometimes you just can't avoid the injury, but are there things that people can do when they're out walking around in the winter time, shoveling, running, these outdoor activities, anything they can do to help prevent getting hurt?
Yeah, absolutely. I think the number one thing is just being aware of your surroundings. You know, when we have that black ice out here in Michigan, and you go to step off of a curb or get out of your car, if that's there, you are going down. And so you really need to be very observant of your surroundings and make sure that you're dressed appropriately. Good shoes, supportive shoes are obviously very important to prevent foot and ankle injuries in this particular time. And then just making sure you're taking care of yourself from a nutrition, dietary standpoint and taking care of your body.
Okay, wonderful. And you know, so many bones in your foot, there are so many ways you can hurt yourself. So how do you know if it's hurt enough to go see a doctor? Like, what should you do if you hurt yourself? I mean, how do you know what to do?
Yeah, that's a great question. So, you know, number one is, can you put weight on the injury? If you can put weight through the foot of the ankle, then generally that means it's maybe not as severe. You know, the other things you look for obviously are swelling, bruising. Any deformity of a limb is a big deal. So if the limb looks deformed in any way, you definitely need to seek immediate medical treatment. If there's any breaks in the ends outside of just a scratch, you know, maybe from like an open fracture or anything like that, obviously that's a more urgent thing that needs to be seen immediately. But really, I mean, we have such good access to care within the Corewell Health network for orthopedic injuries that if you have any concerns, I definitely recommend that you be seen as soon as possible.
Okay, perfect. And going even a step further, obviously you say, you know, you see a bone sticking out, go to the emergency room. But how do you determine, well, hey, can I wait and go see my general practitioner, or should I be going to urgent care, and determining where to go?
Yeah, I mean, again, from an access standpoint, we have an orthopedic urgent care at the Lake Drive location within Corewell, and it's 8 to 8 Monday through Friday, and then 9 to 3 on Saturdays. And so really, if you want to get it checked out, there's really no point in waiting to go see your primary care doctor. You can just head over to the urgent care. You'll get x-rays, you'll be evaluated by an orthopedic trained specialist, whether that be a nurse practitioner or a PA or a physician, and you'll get an immediate diagnosis and treatment plan at that point in time, instead of wait around for a primary care referral.
Yeah, perfect. And I'm speaking from experience. I just got off a boot, and I had a great experience at the Lake Drive facility. I've been there and I'm very familiar with it. The care has been amazing. Talk to us a little bit about some of the newer, unique procedures that are available to help fix it. Because literally, I was, 6 weeks off it. I'm 2 weeks in a boot, and now I'm walking. So it's been pretty good.
Yeah, you know, the foot and ankle world surgically has really progressed quite a bit in the last 20 years. If 30, 40 years ago, we weren't really putting, like screws and plates into feet. That's relatively within the last 3 decades or so, we started doing that. And we've noticed that as we become more surgically aggressive with fixing fractures and whatnot in the lower extremities, that we can decrease the amount of time that it takes for a patient to get back to normal life. Some of the other innovations include ankle replacement surgery, which in the last decade has really progressed quite a bit. So now if you have really bad ankle arthritis, you don't necessarily have to have an ankle fusion. You can have an ankle replacement, just like a knee replacement or a hip replacement. And then there are some other, very exciting minimally invasive surgeries that we can do with smaller incisions that will get patients back to normal sooner than with a more open exposure surgically.
All right, wonderful. Dr. Arard, if people want more information, what do they need to do?
It's easy. So we have a great Corewell Health orthopedic website that you can go to. You can get more information about the orthopedic urgent care. You can search all of our doctors, and they have a profile about where we did our training, what our specialties are, what kind of surgeries that we focus on, and then you really can just go from there to figure out where you want to get your care.
Perfect. Well, we appreciate your time. Thank you so much. And of course, as always, you want to learn more, spectrumhealth.org. We'll be right back.